My experiences as a child with von Willebrand's is very all over the place, quite traumatic at times. So I was inspired to be a nurse because of my experiences. As a child, I was kind of very resentful of it. Like, oh, I've got to go to hospital, got to take tablets. Like, I hated taking my tranexamic acid tablets. I wouldn't take them. Um, I I was actually diagnosed with needle phobia as a child because of the trauma around injections. I literally had to be pinned down for treatment. I'd kick and scream and punch, which obviously would make bleeds much worse. I didn't do prophylaxis as a child. It was never offered. So I'd have a big bleed every couple of months that required hospital and then overnight stays in hospital. And it would either be me delaying it because I would be fighting, or the medical professionals would delay treatment because they were like, oh, it's just a nosebleed. And it's like, despite us going, well, the nosebleed's been going on for hours and hours. Whereas now I do prophylaxis, so I very few bleeds now. It's completely different life now as an adult. My lifestyle as a child, I think, was very resentful and not really wanting it. Although we had this support network, we kind of you just got on with it, a bit blasé, and if you did bleed, it was, oh, here we go again kind of thing. Whereas now as an adult, I'm like, I don't have that many bleeds. I try as much as I can to have a good quality of life. Like, if I want to do something, I'm just going to do it, and I'll deal with the bleed if it happens. My centre are very much like, they're really promoting prophylaxis, and direct quote from my haematologist is treat for quality of life. So I went ice skating last winter. I've never been ice skating before in my life. I'm going to go horse riding soon. I've never been allowed to do horse riding. So now I'm like, actually, I want to do these things. I've always wanted to do them as a child. And I've got the tools now and the understanding now to do it. Whereas as a child, it was always taught, like, no, don't do it. Like, you're going to bleed and then you'll be in hospital. And